lateral elbow pain is a very common problem we see in clinic. It's very important to distinguish where the pain is coming from, because obviously the treatment can be successful or not depending whether the diagnosis is correct. One of the most common problems is lateral epicondylosis, or also tennis elbow, which is a degeneration of the common extensor origin. So all those tendons insert into the lateral portion of the distal humerus, and those muscles which allow you to bring up your wrists and your fingers. Obviously, you use your muscle, your hands every day for majority of your activities. So repetitive trauma, micro trauma, overloading, and indeed aging. So lack of or reduction of blood supply to the tendons are contributing factors to degeneration of the area and initial tearing. One problem that brings the patient back to clinic and we see failure of conservative management is the scarring tissue in this area happens quite erratically, so in a disorganized orientation, and so the scar tissue is not plastic, it cannot be stretched, and therefore new tears happen, and so new inflammation, and the pain doesn't go away, and you start a vicious circle. So it's very important in the rehabilitation you do that you work on eccentric loading, so where you load the muscle but while the muscle stretches out, so that the fibers and the scar tissue happens in the longitudinal or alignment, same alignment as the tendon. So that is a more functional tissue, and perhaps the pain goes away after time. Obviously, education and adaptation and learning to do things in a different way also helps, as well as bracing and splinting just to rest the tendons for a period of time can also be of a great help. Injections, they could be considered. Steroid injection have been shown not to give any long-term benefit, and at times once the steroid effect disappears, the patient is back in pain and perhaps with even more pain than before. PRP, which are platelet-rich plasma, can be used in my book when there is no tear in the tendon. And these help the healing process of the tendon. At times surgery needs to be considered. This is mainly when there is an underlying pathology or a predisposition of the ligaments, either for a damage or a previous overload or microtrauma or trauma, or hyperlaxity of the joint, so where there is a intrinsic symptomatic micro instability of the elbow, and so ligament needs to be addressed as well as the tendon.